Okay, hello. Hope everyone's doing well. Anyway, yeah, I hope everyone's having a good Sunday evening. I am here to hang out with you guys, but hey, Vanessa, hope you're doing good. But anyway, how's everyone's weekend been? You guys had a good one? Oh, hey, all my kitties. Hope you're doing good. Good. Glad you guys are doing well. Good, good. I'm so happy it's finally starting to cool down here. I mean, we're still like in the upper 80s, 90s, but it's cooling down at night, which is good. That's what I'm needing. But anyway, you'll have to excuse how bad I look. I have not been getting very much sleep and my skin is showing it. I look a mess right now, but that's what makeup is for. So I will be doing extra full coverage tomorrow because I don't think I've had dark under eye circles like this in a while. Like they are like that purpley blue color. So, ugh. But anyway, so I wanted to come on here and share some news with you, and also I need suggestions. So I have had a really, really crappy week. This week has sucked so bad. Very, very, very long story short, Friday morning, I was noticing Castiel was going to the restroom a lot, going into the cat box a lot. Got home Sunday afternoon after work and still having the same issues. Called the vet, made an appointment for Saturday morning. That was the soonest we could get him in. So we took him in at 8 o'clock on Saturday, yesterday, and we had to leave him there for like 4 or 5 hours. So, very long story short is that he has bladder stones. So he has stones in his bladder, and he has calcium oxate crystals. Um, what that is especially with male cats, if they eat too much dry food, then their urine will concentrate, and then it forms crystals inside the bladder and urethra. I've already had this situation happen with my other male cat. His name was Cracker Jack, and anyway, so we had to pay the office visit, and they put him in a little kennel with a cat box with like paper in it, and he would not go pee. He was not passing very much urine. But so anyway, they ended up having to do an ultrasound and go in with a needle straight into his bladder through his belly and get a urine sample that way. But yeah, he has these crystals and these stones, and um, the only thing that's gonna help it, the only thing that's gonna get rid of it, and they can come back, is surgery. The vet did suggest putting him on prescription diet and everything like that. So this 4-pound bag of Science Diet prescription for urinary care was $26 for a 4-pound bag. It's a 4-pound bag. And then we had to get, sorry, I need to cover up. But yeah, we had to get prescription antibiotics for him as well. So he's got 2 boxes of that. And then also had to buy more canned cat food because he would get canned cat food a couple times a week, but adding more moisture to his diet can help dilute his urine. But yeah, supposedly, if it's a certain type of crystal and stone, a higher pH, a different pH diet can help dissolve them. But the kind Castiel has, they can't be dissolved. They have to be surgically removed. So yeah, really, really crappy weekend. I don't know. So yeah, so we ended up spending $345 for part of it. So I got to cover up addresses, but yeah. So yeah, I mean, it was just the ultrasound was just $65. Yeah, just horrible, just horrible. And then for his actual surgery, it's going to cost $1,400 for his surgery. I don't know. I'm kind of at the point where I'm just so overwhelmed at this point, you know? Yeah, I know prescription cat food, like all my kitties, I feel so, yeah. I know I went through this with Frack. She has kidney disease and the bag was $40. Yeah, it's horrendous. You know, but the thing is, you know that they know that people love their animals and they're gonna do it. You know what I mean? So I don't know. I'm at the point right now, I'm just so overwhelmed with first it was, you know, Thor has that lump on his neck that we're watching. And now this thing with Castiel on, you know, that just started Friday. Well, symptoms started Friday. And then with the wedding and then work, I mean, I don't know. I don't know. I need help, you know. I don't know what to do because I'm so overwhelmed at this point. Um, I'm so sorry, Sherry. I lost my male cat in February due to urinary complications, and it happens to male cats. It seems like a lot. So, I mean, I'm sorry. This is gonna be a total complaining session, but I'm just so like, you know, they're on the grain free. They have two water bowls that get washed daily, and you know, scoop the cat box every day, and you know, like I don't know. I'm overwhelmed. I just don't know what else. Yeah, all my kitties, have you ever tried Pet Wellbeing? It's pet supplements. Yeah, Castiel has actually been on urinary pet supplements for the last, I want to say like 2 months. Um, so I don't know. I don't, but I'm getting to that point where I just I don't know. I just want to give up. And I'm not saying I'm not saying anything like super like, but it's just kind of like at the point where it seems like no matter what I do, it's always something. You know what I mean? And Sean and I were actually talking about this, and I'm like, I'm so tired of bad stuff happening to us. You know, first it was our daughter, and then it was Tatanka, you know, had to spend all that money on Tatanka, and you know, now it's Castiel and Thor's got his thing, and it's just like and he's like, Kim, he's like, bad things happen to everyone. And logically, I know that. I know that everyone goes through hard times and everyone experiences these things in their lives that just totally upturns it, you know? And I don't know, I don't know. I guess I need to change like my perspective, but it feels like it's one thing after another. And that just might be being an adult. You know, I'm 34, but it just might be part of being an adult. And maybe it's because I've never experienced a lot of loss in my life before before Maggie, before our daughter, I never, yeah, you lose pets and stuff, but I never had really experienced loss like that. So I don't know. I don't know. It's just weird. But thanks, Jennifer. It will get better. And logically, I know that, but I get stuck in these spots. I get stuck in these like spots of like nothing is ever gonna get better. And I almost feel like I don't want to get married to Sean because I feel like if we get married, something bad's gonna happen. You know what I mean? So I'm just, I don't know. And I guess I'm mad too because I see these people that have kids that they don't take care of, or like our next door neighbor that has pets that she doesn't take care of, and it seems like they're fine. You know what I mean? So I don't know. I'm having a pity party. I'm stressed to the nines about Castiel. I'm stressed to the nines about how we're gonna pay for this dang surgery because he's not doing good. Um, I don't know. Stressed about the wedding. It's just it seems to just pile on all at the same time, and it's just hard. I don't know. So, I need suggestions. How do I how do I get out of this headspace? Like, I painted my nails and I was so behind on filming because I usually film all Saturday, but with the vet and everything, I couldn't film. And then I had to go to the laundromat yesterday, and I'm trying to keep to my schedule. I'm trying to keep to my schedule, you know. Um, Thinking, okay, if I can just keep busy, if I can just keep to how my regular routine is, that will help. But I need some more suggestions because, like, I'm getting to that point. I don't want to go to work tomorrow, which I can't do. I need to go to work tomorrow, but and I know Sean will take good care of the cats. I know they will. I know he will. He'll do fine, but I don't know. So I need suggestions on how to things I can do to be proactive and things I can do to get into a better headspace because I'm so worried about him and I don't know. Thank you, Vanessa. It's very sweet. Yeah, that's a tough one for me, Sherry. I totally live in the past and the future. I never live in the now, ever. So that's definitely something I got to work on for sure. Ugh. But yeah, he's still eating and drinking. He's not drinking much, and gave him canned cat food this evening, and maybe ate half of it, not even half of it. So his appetite's definitely down, which is worrisome because that boy likes to eat. He is a big boy. He is 19.6 pounds yesterday was what the vet said. Thank you, neighbor girl Bradshaw. I appreciate it. I appreciate it a lot. But uh, yeah, he is a big boy. He is. And I think he's actually lost a little bit of weight, but he's tall and he's big and yeah, he's definitely a big guy, but But yeah, I don't know. Hopefully, yeah, I don't know. He hates his medicine though. I have to use a little syringe to give it to him. He hates it. Absolutely hates it. But he's being a good boy and he's letting mama do it. So, which is good. But, uh, so I do want to say this. I started GoFundMe. Link is down below in the description. If you can't donate, totally get it. But if you could please share it. I've got 2,000 subscribers and nowhere near that many watch me, which is fine. But if you could please just share it. A buck goes a long way. So I'm just gonna try to keep up the GoFundMe for like a week, and then we're gonna see if we can go get a loan from the bank. We really can't afford it right now, but it's this is basically what the vet said yesterday. Is we do this? They call it a stone diet to try to break down the stones, even though the kind he doesn't have the kind that has it. Um, we can do the stone diet for like a month, but he's gonna need surgery. So basically, what the vet said is that we can keep him comfortable. We can try to keep him comfortable until he gets a blockage, and then he has to get put down. So yeah, surgery really is the only choice. Surgery is the only way to correct this. So, but no, we haven't set the surgery yet. We don't have the funds for it. They don't really do like payment plans, so we got to have it up front. So, hey, 70s girl. But yeah, he absolutely hates the prescription diet. He absolutely hates it. Uh-uh. Nope. So, I don't know. I don't know. I don't know if I yeah, I don't know. I sadly have to take him to the same vet that messed up on Cracker Jack. Cracker Jack was a lot more severe. He was partially blocked and um have you tried playing for Care Credit? I did that when my dog. He needed to have some medical procedures. Care Credit lets you pay interest free for up to 24 months. He has to have a Christum. He has to have a Christotomy. He has bladder stones and calcium oxate crystals in his bladder. So they're the type of crystals that won't dissolve with the prescription food. So yeah, so basically they have to like cut him open, take out his bladder, cut open his bladder and like remove the stones and crystals. And then I guess they have to like send the stones off and the crystals off to be tested. So, but they said he didn't have any infection. They said that because when they did the UA, they were checking for red and white blood cells and bacteria. He didn't have any infection. But what they said was that giving the antibiotics can help with the inflammation in his urethra and his bladder. But yeah, so yeah, doing the antibiotics twice a day, every 12 hours, and the prescription diet, and trying to push the water, but yeah. But yeah, when they checked his heart rate, it was 150, which I guess is normal for a cat, and he didn't have a fever. And the vet was saying like what he first thought it was a UTI. He's like, well, because when cats have blockages or crystals, their heart rate is so fast you can't even count it. So yeah, his heart rate was about 150, no fever. And then when he calls us and says, okay, we found crystals, and when we were doing the ultrasound to do the needle into the bladder to get the urine, they found stones, and he said he has a couple of large stones. They're not sure how many because I guess you have to do a X-ray to actually like see how many stones, but give him water by a syringe. Yeah, I could do that. But I mean, yeah, I can definitely do that. I was doing that with Tatanka before we had to get her put down. But the thing is like this is where I'm like overwhelmed is because I have to go to work and I get up at 4:30 in the morning. And so it's like if I was going to be doing the syringe, giving him water by the syringe, I'd have to do that every couple of hours. So I don't know. I don't know. Yeah, 70s girl, that's what they said they needed to do. Um, and it's the type of stones that won't be dissolved with food with the pH stuff. So, yeah, I'm sure I don't know if this is pretty normal, but it's $1,400 for the surgery. So, yeah, I don't know if that's normal for this, but I don't know. It might be completely normal or it's cheaper. I don't know. When I paid 2 grand for Cracker Jacks, but his was a little bit. Hi, Diana. But that's about right. Well, that's good to know. But so, 70s girl, is there anything I can do to make him more comfortable? I tried a warm compress like on his genital area because of course he's looking at it a lot. I tried an ice pack wrapped in a tea towel. I'm trying to leave him alone. You know, I don't know. I'm just, I don't know. Chad says our cat Baloo had crystals in his bladder too. It's from high ash in the food. It concentrates in the bladder and it just can't be dissolved. He'll need different food after surgery. Yeah, he's gonna have to stay on the prescription diet. Yep. Oh, Diana, my cat is super sick and needs surgery. No, they didn't give me anti-inflammatory drugs. They just gave me um this is Amoxi drops, 15 milliliter. So I have to give these to him every 12 hours. He gets 2 milliliters. So, but yeah, Castiel's been doing that. He lays on the floor. But yep, that's what Castiel's been doing. He's been doing the little frog lay down, kind of on the floor, spreading his back legs a little bit. Hey, Chad. But but yeah, just trying to hang in there and trying to not get completely completely losing my mind. But um yeah, I'm just trying to stay, I don't know, I guess present is the best way to put it. Um my mind automatically goes to the worst case scenarios no matter what. And I'm trying really, really hard to fight that. So um yeah. Sorry it's a crappy stream. I'm sorry it's so negative. But um but yeah, really, really, really appreciate if even if it's $1, if you could donate, or if you can't donate, just share it. Um, yeah. Yeah. That's what the vet said, 70s girl. Yeah, Diana, I guess it is pretty normal for the kind of surgery he needs. $1,400, yep. But but yeah, the the GoFundMe is down below. Oh, tell Levi hi and tell him I miss him and I hope the baby's doing good. But anyway, like I said, the GoFundMe is down below. If you could just please share it at least, that'd be amazing. Yeah, just if you could please share it. I've already, I was absolutely amazed. I had one young lady that was in my training class. I know her outside of the internet. She was so sweet and donated $50, and I've had a couple other people. I think right now we're at 105. So, um, um, two people have donated on my GoFundMe, and two other people they ended up going through Facebook, which creeped me out. I didn't know that could be done on Facebook, but it was creepy. I didn't like it. Um, I haven't tried applying for care credit, but I think you're like the third person that has said something. I might have to go on and check it out. I did a little bit of research and it was like 26% interest rate. I think we're gonna try to go to the bank and see if we can get a loan. Yeah, so they have it all like for the office visit, the anesthesia level 3, the cystostomy. That's the most expensive. It's $560 for the actual surgery. And then the hospital and post-op recovery, pen medication, culture and sensitivity, mailing and shipping, pre-analysis blood work, anesthesia, cath, x-rays, first and second views. Yeah, but what did I read wrong? Oh, no. So no, I applying for care credit at the vet. Yeah, they had something at the vet that they gave us a little brochure. That's what I looked at, where it said it was like 26% interest rate. So, but I think I'll go look at it. First 6 months interest free. Okay. Yeah, we could get a cosigner probably. We could probably find one. Yeah, I might have to look into that. But I don't know. He's still eating and drinking for right now. I read the pamphlet wrong. Got it. Got it. Got it. Got it. Castiel is almost 5, so not super young, but he's not. I think he's still considered adult at this point. I think 6 or 7 is when they reach senior or whatever. But yeah, he's still young, I think. But yeah, I'll look at the brochure. I guess I read it wrong, but uh yeah, my credit's not the I mean, I paid off all my debt except for one thing, but it's pretty low still, so but I'm gonna definitely look into it because if I want to get that surgery done as quickly as possible. He's so miserable and it's killing me to watch him go through it. So, but but if you were thinking of donating like doing a super chat or a, the best wedding gift that you could give me is to share that GoFundMe link, please. Oh, Lucy, Lucy, you didn't have to do that. Thank you. Thank you so much. You're very, very sweet and generous. Thank you. But yeah, just share that GoFundMe. Like I said, I'm going to look into that care credit when I get off of here. And I think I'm also going to talk to the bank, see what we can do. But 70s girl, I'm so glad. I know you don't always get to come into my streams, but I'm glad you stopped by because um, thank you so much for stopping by because yeah, makes me feel a little bit better about going ahead and going through with the surgery because I really don't want to get him put down. But Lucy, thank you very much. And I just saw it just popped up on my tablet that um, yeah, that somebody shared. Um, yeah, neighbor girl Bradshaw shared.
He wants to say hi.
Oh, come here.
Come
here. Come here. It's okay.
okay.
Castiel wanted to say hi. Yeah. But they shaved his belly. His little belly's all shaved. But okay. There we go, sweetie. I'll see you later. I know, sweetie. He's gotten a lot more whiny and cryy too. But feline lower urinary tract disease is common in male cats. Calcium oxalate crystals. Yeah, that's what he has. The calcium oxalate in the urine becomes alkaline because the cat's diet may not have enough meat in it. We went grain free after Tonka May passed. It was what, November? It would have been November. We went grain free. So I don't know. I don't know if I need to be the kind of cat mom that just makes their cat food at home from like chicken and stuff. I might need to do that. But he is adorable. But yeah, I might just have to. I mean, even this crap, this $25 bag, this 4-pound bag, the first ingredients are it's brewer's rice and corn gluten meal. This has, I mean, I understand that it's supposed to like change the pH, but I mean, there's like no commercial cat food that is like good, I guess. But yeah, I don't know. But thank you, neighbor girl Bradshaw, for sharing the link. I saw that pop up on my tablet. And thank you guys for coming. And thanks for we were feeding him the Purina Pro grain free. It wasn't like Nutro, but it was like $30 a bag. But I guess that's even garbage cat food, so I don't know. But now Sean was looking this up, and you can actually get it cheaper. It's like $70 a bag, but it's cheaper besides the vet because this was almost 26 for 4 pounds. So yeah. Yep. It's brewer's rice, corn gluten meal, chicken byproduct, pork fat, egg product, calcium sulfate, lactic acid, chicken liver flavor. Yeah. So have a good night. Have a good night, Giggles. But yeah. So yeah, I just might need to start making cat food at home. That's might be what I need to do. But I just wanted to say thank you for coming and listening to me to complaining and being a total complete stressed mess. I was texting my friend and I've been having chest pains all night, and I know it's just anxiety. I know that's what it is. But yeah. He is just a big fat gray cat. I don't know what kind of breed he is, but he's a big old boy. He's a big one, but but yeah, wedding stuff is on track, and my brain can only like handle one catastrophe at a time, you know what I mean? So um wedding stuff is still going good. We're gonna be going and getting the marriage license here next week. Um, but right now, you know, let's see, 50% dire wolf, says chat. um, I don't know. The doctor, the vet said that we could try this for like a month, but he doesn't. With the type of crystals it is, it's not going to dissolve it, but it could help to reduce inflammation in his bladder. So, because he said there's a lot of crystals, but they're like the size of a piece of sand, which is still very, very large because a male cat urethra is so small. That's why male cats have a harder time passing crystals. But then eventually they can kind of clump together and they'll form a stone, or they'll just clump together and then it can create a blockage. And then, yeah, it's bad. You can supplement his diet by putting chicken in his diet or other meat, no seasoning cooked meat acidifies the urine. Okay. I don't know. He's a Walmart kitty. He's a kitty that I got outside of a Walmart. People were giving away kittens, and he was cute and he was the runt. So he might, I don't know, he might be Russian blue. He has a little white patch like right here, but the rest of him's completely gray. I, yeah, yeah. But I I'm still trudging on, guys. Videos are going up as planned. I did get stuff um I did get stuff filmed today, so it's not gonna be an issue. I'm still gonna be filming stuff for the wedding. Um, so all that. But let me know if you're interested. My future sister-in-law is going to be coming over. I'm going to be doing her hair and makeup. So I've never done someone else's hair and makeup on camera before. So let me know if you'd be interested in seeing that, because I'd be happy to do it. She's got a different face shape and different eye shape and stuff like that. So if you'd like to see that, let me know. I'd be happy to do that. But yes, the runt is always the best one. I agree. I agree. But yeah. Anyway, I think I'm going to get off of here, and I'm going to go um go try to get him to drink some water. That would be interesting. Cool. I thought it'd be fun to do. But cool beans, I'll do that. Um but anyway, I better get off of here. I got to get some stuff done before I go to bed to go to work. But I hope you all have a wonderful evening. And thank you so much for everyone that came and tuned in. Thank you for sharing the link. I hope you guys have a wonderful weekend, and I will see you guys next week. Hopefully a little bit happier. But thank you so much, Neighbor Girl Bradshaw. I do appreciate it. Anyway, guys, have a great one. I will see you next week. Bye.